Welcome, welcome to all of our newer folks. We're happy you could join us. I'm thinking we'll give it maybe another minute or so
Okay.
before we officially kick things off. Welcome, everybody. Welcome. And I think we can go ahead and get started.
Okay. Uh,
All right. Well, welcome everybody to Healthcare for All Minnesota's quarterly meeting. This also serves as our end of the year meeting and a good recap as we reflect on all of our successes for 2025 and talk about what's in the year ahead. So thank you for joining us tonight. This meeting is scheduled to run until 8 p.m. Feel free to just sit back and relax, and we'll go over the meeting norms in just a bit. All right, and if you can go to the next slide, please.
Actually, I just have listed our presenters for this evening and then our agenda, which I'll review it quickly after Bahia hands me the baton.
Oh, my apologies. I thought we had the norms on a separate slide. My apologies.
Wait,
I'm I'm
it's in
going
your brain, Bahia.
it's in my brain for tonight. All right. So speaking of meeting norms, and there's just a handful, and it's just to give us the opportunity to make sure that we minimize interruptions and folks can participate as fully as possible in tonight's meeting. So a few things. One, this meeting is being recorded. We like to share it with folks who are unable to attend. So we'll share out the recording afterwards and any corresponding handouts that'll be helpful for folks to peruse. Secondly, make sure that you're muted if you're not talking. We do have a sequence of presenters that will be presenting on various topics. And if you have questions throughout, we have the chat enabled. So you're welcome to ask questions in the chat, leave comments in the chat. I will be monitoring it throughout. And then in addition, we will have a designated question and answer at the end of the meeting. In addition, it's always great to see folks because we're not meeting in person. It's nice to see your videos on. I understand everyone has different things they may be tuning into this evening. You may be juggling kids and your family and other to-dos while you're trying to tune in. So if you need to have your video off, do what's most comfortable and best for you. But if you're able to have your video on, that would be much appreciated as you're able to. And so with that being said, I'll go ahead and turn this over to Anne.
Yeah, thank you. Thanks so much, Bahia. And I hope, welcome. Also, I hope you all have your favorite holiday beverage in hand, or maybe your happy hour beverage. You don't have to drive anywhere. And thank you for tuning in tonight to join us for this important issue of health justice. Our agenda this evening starts out with a report on our fundraising efforts for 2025, followed by information on what we do with those funds. Our chair, Rose Roach, will then offer a review of 2025, the work we're doing to meet with legislators about our legislative priorities, and a look ahead to 2026. We do have time on the agenda, as Bahia announced, for your questions right after Rose speaks. And then we'll go back to Bahia, who will talk about our plans for Lobby Day 2026, our our Day on the Hill at the Capitol. And then I have some announcements and a pitch for your financial support as a last chance for the work ahead in 2026. And we will wrap up by 8. So cheers. And Bahia, you are up next.
Wonderful. Well, hello, everybody. For those who I haven't had the pleasure of meeting yet, my name is Bahia, and I support HCAM in ensuring that our operations are running as smoothly as possible. And if you can head to the next slide, please.
Okay.
So Anne had referenced our fundraising efforts. I'm very much excited to present out about our fundraising successes over 2025. So just a few major items that we wanted to update you all on. We started with an in-person fundraising launch for our Give to the Max campaign. This was back in late October at Bad Weather Brewing in St. Paul. We had quite an amazing turnout. If you don't follow us on social media, I definitely encourage you to do so because we did post some photos and information about the success of that evening. From that in-person fundraiser, we were able to secure $4,100 to kickstart our Give to the Max campaign, which concluded on November 20th of this year. And so between October 23rd and November 20th, we raised a total of $20,000 and $882. So we exceeded our $20,000 fundraising goal, which was very exciting for us, given that we're a small but mighty nonprofit. And from the online donations themselves, we raised $16,782 of that 20,000 plus that we were able to bring in for this campaign. And we know many people on this call were able to contribute to Give to the Max. So we just want to share a heartfelt thank you for all your contributions and your support, whether it's been monetary or through volunteering or resharing our posts on social media. Every contribution really helps us get closer to securing the Minnesota Health Plan and really bringing healthcare reform across the state of Minnesota. I also want to highlight just a handful of annual fundraising statistics. So we received a total of 228 online donations this year, which is significant. It's higher than any previous year under HCAM. So it shows that we have a steady progression upwards in terms of our ability to increase our donor base. We raised a total of $46,500. As you can see, a significant chunk of that is from Give to the Max, and then the rest is from small-time donors who've been gracious enough to give as little as $5, as great as $5,000. And so we have a wide array of donors that are able to contribute to HCAM. Our average donation per donor, if we look at all the donors cumulatively, is about $200, which is a significant amount, again, for a nonprofit of our size. And then, excuse me, earlier I think I said 228 donors, 228 donations, and then 73 donors across our online giving and in-person donations. So just wanted to show you all the great work that we're doing when it comes to fundraising. We significantly rely on donations to fuel the work of Healthcare for All Minnesota because we are a nonprofit. We have very limited abilities to have various revenue streams and income streams. So we rely heavily on our donor base. And so if you've considered giving to HCAM but haven't, you are more than welcome to. We always welcome giving, even after I Give to the Max campaign. And so throughout tonight's presentation, I'll be dropping the donation link if you're interested in providing as much as you're able to give. So we appreciate any amount you can offer. Thank you.
Okay. And then Don Pilkinen, longtime healthcare reform activist, board member, and secretary treasurer of Healthcare for All Minnesota, presents next. During this last quarterly meeting of the year, you can see that we take some time to share how we're doing with fundraising and how we use the money that our members generously donate to this organization. So Don, go ahead.
Don, are you on?
I don't want to be talking to myself. I want to be visiting with all you good folks out there. I'm Don Pilkinen, HCAM's Treasurer Secretary, and thanks, Ann, for the introduction. Now that it's the season of budget setting by government, along with the holiday season, I'd like to begin by what budgets mean to the well-being of people, including HCAM's budget. As we're leaving the old year and going into the new year, the battle of budgets has begun for Congress and state legislatures, where contending political interests are making news for the haves who desire lower corporate and income taxes for more profit and wealth, and those with less who need affordable housing, nutrition, and health care. Some would say that such contention turns budgets into moral and amoral documents that may apply to businesses as well. And speaking of the season, what did Dickens say about the morality and goodwill of Scrooge and Marley, where Bud Cratchit had to do the bookkeeping? And budgets of nonprofits may also reflect the morality of their work. Here at Healthcare for All Minnesota, what defines the work for which we're budgeted? I think it's for both a moral and pragmatic purpose based on Paul Wellstone's economic and moral thinking of we all do better when we all do better, which in turn is the basis of our work to reform healthcare delivery finance so everyone is in, gets necessary healthcare when they need it, and no one is left out. In economic and moral terms, that's been proven to be the best for individuals, businesses, and government in advanced democracies. So, on a small budget, HCAM is a true nonprofit, is doing a giant's job in advancing single payer for our state in the campaign for the Minnesota Health Plan, where no one is left out. And we will continue doing our part in the campaign that Rose has been organizing. HCAM always raises the necessary income with successful fundraisers such as the Give to the Max campaign led by Bahia. And we will be needing more for the ongoing expenses in 2026. We're fortunate to have Bahia and Jen as our Director of Operations and Social Media Manager, whose professional work is worth much more than their pay. Our successful presence at Pride Fest and the State Fair requires liability insurance. Our successful presence for too long, travel costs for our outreach and education volunteers has been paid out of pocket. Outreach and education depends on descriptive information and identity with a continual supply of buttons, banners, business cards, policy handouts, and brochures. Our organizing and information meetings and outreach to supporters have grown with Zoom and the Every Action platform, and our website needs regular updating. So there they are, expenses waiting to be paid in 2026, along with the required registration and merchant service fees. For more detailed information, HCAM's annual report will come out in January. We appreciate your knowing these expenses and thinking of how much you can help. Thank you.
Oh, thank you, Don. Thanks so much. And next, our chair, our Healthcare for All Minnesota chair, Rose Roach, will talk about our 2025 year in review and a look ahead. And Rose, I think I need to take my slides down, correct?
Yes, ma'am.
Let you on. Okay. Will do. All right.
All righty.
Here's everybody.
Let's see if we can make this actually happen. Let's see if I can do it. All right. Let me know if you are actually seeing my slides or are you seeing my just the slides? Okay. Yay, success. I always get excited when that happens. All right. Well, good evening, everyone. As Ann said, I am the very proud chair of Healthcare for All Minnesota, Rose Roach. So, 2025 has been a very, very active and productive year for Healthcare for All Minnesota. I want to take this opportunity to thank the HCAM board, the chairs of our committees, and especially our amazing Director of Operations, Bahia Manasra, for her incredible work in keeping not only the operations of the organization on track and excelling, but also her laser focus on fundraising with results that, as you saw, exceeded our fundraising goal for 2025. I also want to thank Jen Crawford, the Executive Director of PNHP Minnesota, who is our partner in this work, for her help in staying on top of the absolute onslaught of news and developments coming at us like a fire hose, right? And ensuring that our social media platforms are kept current and informative. And of course, I want to thank all of you for your continued support and engagement in this health justice campaign. So as we look at the year in review for 2025, we're going to look at the major projects within the organizational structure that's based on our committee structure. And then we'll wrap up with a brief look ahead for 2026. I'm going to do this at a little bit of a 10,000 foot level for tonight because, as Don said, we need you to watch your inboxes in January, as there will be an actual written annual review coming to you to detail all of the good work of the organization. So let's start with our Legislative Policy Committee. The work in this committee has been extremely busy and successful, as you might well envision. A major focus this year has been ensuring legislators understand why the deprivatization of our public health programs, Medicaid, Minnesota Assistance, and MNCare, Minnesota Care, is critically important to our work to build the public health infrastructure as part of our pathway to the Minnesota Health Plan. To date, we have met with 19 House representatives, 9 senators, and the health policy staff for Governor Walz. We plan to meet with another 20 or so legislators from both parties before the February 17th session begins. Complementing those personal meetings is a letter writing campaign that gets this information by our members in front of legislators, one argument at a time. The studies, reports, and plan options for deprivatization that are due to the legislature in 2026 is incredibly important work as well. Anything coming from state agencies can and usually does heavily influence how the legislature proceeds with any kind of action related to those studies. Reports and plans, studies, reports, and/or plans. So ensuring that work is evidence-based, that it is unbiased towards the managed care industry, and is comprehensive is really critical work. We have engaged in multiple meetings throughout the year with staff and hired consultants at MDH on their low-value care and administrative cost studies, in addition to getting Healthcare for All Minnesota members seated on the Center for Healthcare Affordability's task forces and monitoring those meetings as well. We've also met with DHS, Department of Human Services staff, and their consultants on the Medicaid and Minnesota Care deprivatization plan options. Work also continues behind the scenes with our legislative champions to refine the patient-centered care bill and provide resources to legislative leadership that can be used in moving that bill forward. We will have a hearing on the bill in the House and likely in the Senate as well. House leadership, along with the governor's office, has assured us deprivatization is absolutely on the table as a solution to the pending Medicaid crisis due to the passage of H.R. 1. This work is making a real difference. So I again thank all of you who have been involved in these very, very important projects. Our coalition builders are working, continue to work, I should say, on strategizing organizations for outreach, for education, and for campaign affiliation. A major focus this year has been to connect with all of the various Indivisible chapters throughout the state. And I know there are a number of you here who are from Indivisible or in those Indivisible leadership positions. Thank you for being here. They have also been a pivotal partner with the Legislative and Policy Committee in launching and supporting the work of those legislator constituent meetings. Healthcare for All Minnesota was once again front and center at Twin Cities Pride and the Great Minnesota Get Together, our state fair. We are having important organizing conversations with voters across the state about the Minnesota Health Plan and our plan for achieving it, which includes the deprivatization of Medicaid and Minnesota Care. We continue to be asked to do tabling at numerous events and are always being asked to give presentations for various organizations across the state. Keep those coming. We definitely want to continue to have these conversations and to spread the word. Communications will be a critical part of our work in 2026. The Communications Committee is now meeting weekly to develop a communications plan that includes earned as well as purchased media opportunities, particularly focused on Greater Minnesota and the need to organize and build power in the rural areas who are already being so deeply impacted by the effects of HR 1, especially our rural hospitals and clinics, due to the massive cuts in Medicaid funding, constantly closing clinics and scaling down services in our rural hospital facilities. Another reason why we must pass the PCC bill and shore up rural health. And then we have the Minnesota Health Plan campaign itself. So as you all know, Healthcare for All Minnesota, in partnership with Physicians for a National Health Program Minnesota, drafted a campaign plan to win the Minnesota Health Plan earlier this year. The organizations you see on the screen signed on to that campaign and have formed the campaign steering committee. Our first committee was held in June, and we've met 5 times since then. The steering committee learned about the importance of power mapping our environment to better understand who we need to focus on to move our agenda, who's best to help with that work, and who will be opposing us as we do that work. The committee also dove into policy stepping stones, like the Patient-Centered Care Bill, and committed to participating in a pre-2026 legislative healthcare priorities summit for legislators. As we move into 2026 with new opportunities for this campaign, the committee will be discussing what structure makes the most sense moving forward to maximize this campaign. 2026 is shaping up to be a pivotal year for the health justice movement, both across the country and here in Minnesota. Healthcare is on everyone's mind, and affordability of healthcare tops the list. As I mentioned earlier, Healthcare for All Minnesota is hoping to co-sponsor a legislative healthcare priorities summit with other organizations who also support the deprivatization of Medicaid and Minnesota Care, and to schedule that summit for late January or early February, just before session begins. We want deprivatization to be front and center for legislators as they go into the session. You'll hear more in a few minutes about our 2026 Lobby Day, but it is March 10th, so make note of that. Another great opportunity to discuss deprivatization with legislators. 2026 is also shaping up to be a pivotal year for Healthcare for All Minnesota themselves, as grant funding opportunities are presenting us with the potential to take the organization and the campaign to win the Minnesota Health Plan to the next level. We have already received funding for a professional redesign of our website, and the board will be engaging in a planning session in January to draft a comprehensive strategic plan that can be used in seeking grant funding for our work over the next few years. You see on the screen a portion of the op-ed written by Dr. Vanessa Dayton for the Star Tribune on November 8th, wherein she challenges those who own United Health stock to divest that stock and reinvest the proceeds into the campaign to win the Minnesota Health Plan. We are so very grateful for Dr. Dayton's commitment to health justice and her ability and willingness to help create the campaign to win it. Einstein said, in the midst of every crisis lies great opportunity. That crisis and that opportunity for restructuring our healthcare system is now. Americans, Minnesotans have had enough of insurance, employer, provider-based systems that continue to eat up more and more of their income while providing less and less access to care. Corporatized healthcare has overplayed its hand. We will take healthcare out of those hands, the hands of insurance companies, and put it back into the hands of patients and their providers. Get ready, because we will all need all of you to keep up the pressure as we move into 2026, what I am calling the year of health justice. Si se puede.
Woohoo! Thank you, Rose. And now I invite everyone to turn their screens on if you are willing to do so. And we have some time for questions and answers. And let's see, Bahia, are we using chat or
We can use chat, or we can encourage
or you
people
can
to,
just put your hand up?
right, do the virtual raise hand.
Okay. Everybody know how to raise your hand? It's on React. Go to React on the bottom of your screen and click the raise hand function.
Vita, that's interesting information to hear that Matt Klein supports Medicare for All. First time hearing of that. Absolutely, Kayla. She's a co-author of the Minnesota Health Plan in the House. I met with Kayla about a month ago. She's a Medicare for All supporter. Her union is one of the pivotal unions, international, national unions in this country, who have Medicare for All at the top of their legislative priorities list.
Excellent. Well, then they all three do, because Matt Little spoke at Senior Caucus in support, and then Matt Klein came in and I asked him point blank, do you support it? And he said yes.
Awesome. I hadn't heard, so that's good. And as everybody may know, Senator Tina Smith signed on to Medicare for All in the United States Senate. I'm so absolutely thrilled that happened. That's huge, huge, huge news. We've actually picked up 6 or 7 new authors, co-sponsors of Medicare for All in both the House and the Senate. So that's a really big deal for us here in Minnesota. It really, truly is that one of our senators has signed on to that bill. So if you haven't done it yet, please consider a quick email or a phone call into our office just to say thank you, Senator, for doing that. Yes, Erin Murphy, of course, is on board with Medicare for All. No problems there. I met with Erin to talk about the deprivatization work as well, and she sees that as an absolute stepping stone and is willing to work with us on that as well. Let's see. Oh, resolutions. Yeah, thank you, Nancy. So will the organization be doing resolutions for precinct caucuses on February 3rd? Yes, as a matter of fact, Minnesota Health Plan is already in the platform. So this year, what we're concentrating on is the patient-centered care bill and the deprivatization work. And actually, Dr. Mark Lebo, who I think just signed in a little while ago, is here, and he helped draft a perfect resolution on that topic for us to be able to take to precinct caucuses and get it in front of the parties. So regardless of which party you're with, we will send those out, make sure they're accessible to everybody. Please take it with you to your precinct caucuses if you're going to caucus. Any other questions for me? These legislator meetings have been really remarkable, everyone. We're really making inroads. The legislators are, they're very concerned, right, about these pending cuts that are coming down from the federal government, and ways in which to try to mitigate some of that harm is very much on top of their minds. And so thinking through what might be possible options other than horrific options like cutting benefits, cutting eligibility, cutting already too late, low of rate reimbursements to providers, raising taxes, which I don't care if they want to do it, they should do it, and do it on the people who got the windfall on HR1 as far as I'm concerned, but I'm not sure if that'll happen. Or they could take, money from public education to shore up public health. But many of you heard me say this before, but I'm saying it again. We got to stop with this either or nonsense. We don't have to have that kind of an environment. We don't choose between feeding children and giving them health care. That's nonsense. We have to get into the mindset of abundance, collective abundance in this country, and understand that there is enough for us to take care of both of those things. And so I don't want to hear those arguments that we constantly get with that. We could save, we think, as much as $1 billion or more dollars a year if we just remove the privatizers from our Medicaid and Minnesota Care programs. That's real money. That can make a difference, and we can really help people stay on those programs. We could potentially improve some provider reimbursement rates. We could improve quality of care. There are so many reasons for that to be the obvious thing to do because it's money we're already spending anyways. Why not make sure it's money we're spending on what its intended purpose is, which is, of course, healthcare for patients? All right. Let's see. Yes, Nancy, you want, yeah. Oh, absolutely. I'll put my email and between me and Ann, and we, can get somebody to come out or, excuse me, do a Zoom. We are more than happy to do that. Please bring us in to have these conversations. It's the only way, is to just start talking to one another about this stuff. And let's answer the tough questions. Let's have people say, but what about this? And think this stuff through together. When I go out lately, I really try to start presentations by asking folks simply, what do you like and what don't you like about the current system? And if you could build the system from scratch, what would you make sure the system had, and conversely, what it shouldn't have? And I got to tell you, by the time you get done with that conversation, they've pretty much built the Minnesota Health Plan, right? And so it really opens the door to involving them and thinking through how we not only can, but deserve a system that centers patients and providers. So happy to come out. Just get a hold of us. All right. If there's nothing else for me, thank you for letting me give you the year in review. I'm telling you, much more to come. Lots of exciting stuff. I think we're going to be reporting out in the March quarterly meeting, because there's a lot of exciting stuff that's going on. And I really do think we are about to really launch this campaign in a very real way. And it's going to be pretty darn exciting. So thanks, everybody.
Okay. Last chance. We are actually ahead of schedule.
Yay!
Probably not good for everybody, right? Okay, I'll move along with our agenda. Okay, let's see. Can everybody? From current. Oh, there we go. From current slide. All right. So next, Bahia is back to talk more about our planning, which is going on already for our Healthcare for All Minnesota, Physicians for a National Health Program, Minnesota, 2026 Lobby Day at the State Capitol. So cool.
Awesome. Thank you, Ann. If you can go to the next slide, please.
Yes, to this impressive list of activities. Yeah.
Thank you. The screen is a bit it's a bit fuzzy from my end. I think I can still make it out. I don't know if other folks are seeing it.
Oh, I wonder if I have, I had to copy using a different method because I think our PowerPoints are incompatible. So
no worries. I can still make it out. So I'm happy to read the content so folks have
okay.
that. So for the 2026 Lobby Day planning, that is underway. There is a planning committee that is leading the charge that's made up of several chairs that are leading subcommittees. And so before you, we basically broke this down into 4 separate components. The first focuses on goals and strategy. So one of our major goals is to increase civic engagement around healthcare reform. A second is to lobby for key legislative priorities. That part is still in development. So more information will be forthcoming as HCAM and PNHP near Lobby Day. And then the third is to target legislators and districts. So to make this Lobby Day as meaningful as possible and to have the most impact. For planning and logistics, as it's been mentioned, it will be March 10th, similar to last year. The time frame is to be determined. We expect it to be starting in the morning and wrapping up in the early afternoon like last year, but those details are still being finalized. The location is still being finalized. Last year we had it at Education Minnesota, and so it's possible that will be the location this year. And we are working on an RSVP form that will be going out right before the holiday break. So be on the lookout so you can RSVP and secure your spots for Healthcare Lobby Day. We're also focusing on securing partnerships and really focusing efforts on coalition building. So that includes combining shared messaging and creating a joint advocacy strategy between PNHP, HCAM, and our health justice allies. Putting together an outreach plan, which includes emailing folks, utilizing phone banks, seeing if we can also utilize texting campaigns, and really trying to be as comprehensive as possible. And also recruiting organizations to help with the engagement, whether it's being a co-sponsor of Healthcare Lobby Day or helping with member turnout and participant recruitment. And lastly, tools and resources. There will be content training prior and the day of for Lobby Day. So that will be that information will be disseminated to people that are RSVPing. There will be legislative talking points that will be created and a leave behind document similar to last year for folks who joined, which is a document that can be left behind with our legislators so they have the high points in terms of the advocacy that HCAM and PNHP are lobbying for. And then lastly, focusing on relationship building with legislators. So we really also want to make sure that as people are becoming more comfortable with becoming citizen lobbyists, that they have the information on how to cultivate meaningful relationships with their representatives, with their senators, and also with fellow health justice allies and their leadership. We want to make sure that this feels like a community for everybody and that you know that you have the support and resources you need to be a part of this movement. Thank you. More information will be forthcoming as we near Lobby Day.
Okay, thank you, Bahia. And I'm going to talk a little bit about, make some announcements, talk about our work at building a base of support for this healthcare reform movement, and then resources that you can use. So coming up is a save the date for that Lobby Day, Tuesday, March 10th, 2026. We will have, as we did this year and for 2025, training for grassroots lobbyists, so you don't have to know everything yet. We will have an evening and a Saturday morning, and then a just in time if you are unable to make either of those, but can come to the actual day of. And those dates will be announced in lots of messages. Mid to late January, we've got really committed activists in the Duluth area who are starting to plan an organizing event in the Duluth area with Healthcare for All Minnesota leaders and leaders of indivisible groups in the local area. And then Tuesday, February 17th is the start of the 2026 legislative session, if you're interested in knowing that. Always, as always, let us know of events that we should either post in our calendar, put on our newsletter, promote attendance, or participate as presenters or for outreach. Please follow our newsletter. We send out a Healthcare for All Minnesota sends out a newsletter. You should get it on the first few days of the month, and that will have actual dates of anything that comes up between now and the event. So open up when you get something in your inbox that comes from Healthcare for All Minnesota. Please open it up and check for news and information you need and you can use. If you got this meeting notice from anyone other than either Physicians for a National Health Program Minnesota or Healthcare for All Minnesota, please put your contact information in the chat or go to our website, which is listed right on the screen, and enter under Get Involved. This gets you into the database so we can stay in touch with you. Also, let us know of speaker requests, and please check your inbox for a call to action from Healthcare for All Minnesota to thank Senator Tina Smith for becoming a co-sponsor for the Medicare for All Act of 2025. This is actually a pretty big development, and she needs to hear from us that we noticed, and we are really thank her for that commitment. And also, there is a call to action. You should have received, again, from Healthcare for All Minnesota in your inbox to send information to your legislators explaining and asking their support for the patient-centered care direct payment to providers bill, our proposal to get the insurance industry out of our public programs, Medicaid, medical assistance in Minnesota, and the Minnesota Care Program. So that is one of our top legislative priorities for 2026. And always our website should contain events on our calendar as well. And then we need your help to spread our message. Just take a look at this slide for social media sites, addresses, and content for you to share. We have some good content going up on our social media sites, Facebook, Instagram, and Blue Sky. Please consider setting up accounts for at least one, if not more than one, social media platform so you can interact with and amplify the message of fixing how we pay for healthcare so it works for all of us. You can also go to YouTube anytime to view and share past educational videos and meetings that have been recorded. We need a lot more followers to increase traffic on these sites. Please read and share our monthly newsletter. Also check both websites, Healthcare for All Minnesota and PNHP Minnesota websites. Updates are ongoing. And then look for articles and information that we can post. You can give us content that you think is important for us to share with the public. And then check for legislative updates. So again, I mentioned that Healthcare for All Minnesota is on Blue Sky. If you're not on Blue Sky, you can set up an account by going to bluesky.com. It's very, very easy. All you need is a valid email address and create a password. Other useful websites are listed here that we make available and then send out to everyone who registered for this meeting, because the more you know, right? And then I know we've been a little bit heavy on fundraising for this meeting, but it's a very important part of accomplishing the mission of this organization. So aside from the funds needed to keep the organization going day to day, much of what you contribute goes to the work of the organizing and base building committee, of which I am very proud of this very dedicated group of people, the committee members and all the volunteers in addition who come and help support this work. We get out to events, we engage the public to bring more people in this movement, to fix how we pay for healthcare in this country once and for all. The money you contribute goes to registration fees and other expenses for having space at various events, printed materials and handouts, banners, buttons, business cards, posters, and the like. We also have expenses associated with the lobby day that we talked about, including printed materials, refreshments, and a fee for the space if that is needed. Before and after the legislator visits, we have to have a gathering spot. And since 2026 is an election year, we are already planning and budgeting for registration fees and volunteers for as many conventions as we can possibly cover, including the state convention. And we are a nonpartisan organization. If we get invited to be at conventions of either party, would be very welcome. We will focus on the conventions where most of our activists are involved, and we will send out information ongoing on how you might be able to help with that. But it's really important that we educate and engage the delegates, the legislators, and candidates for office in Minnesota. So these are critical to getting office holders, the office holders we will need to move our legislative priorities in 2026 and going forward. So your contributions of time and money are how we will win. If you are thinking of including Healthcare for All Minnesota in your year-end contributions, please look for this page on our website. If you are able, we especially need people who are willing to commit to a monthly amount, as any amount is helpful as sustaining donors. And just go to our hca-mn.org to donate. And many thanks to all of you who have donated, volunteered, and in any way helped spread the message on fixing how we pay for healthcare in this past year. So that's my contact information. And then thanks again for joining us this evening. Happy holidays, however you celebrate, and we will see you in the new year. Bahia, do you have anything to say to wrap up for this evening?
Nope, you've got it covered. Thank you for your great announcements, and they're certainly appreciated. If there are any lingering questions for maybe a Q&A, we can certainly answer anything else that comes in the chat, or if people want to go off mute and ask, that works too. Somebody just asked in the chat, which group is working the most with HCAM in the Duluth area?
So is Tom Starkey still on? Tom? Tom is leading organizing in the Duluth area, and Jerry Whitty, I think, was on in the meeting as well.
Diane.
Tom, go ahead.
Well, we don't have a chapter in Duluth, but we have several individuals that are actively trying to get the message out and create some civic engagement with indivisible groups, with churches. So that's kind of where it's at. We're trying to grow and trying to, we had our legislative presentation was a real success in November. We had several different groups that attended at government levels, as well as the community organizing groups. And we're making headway with Duluth Indivisible. The largest indivisible group is interested in taking on the PCC bill and working on it. And we're hoping to have a big event, like you mentioned earlier. So that's kind of where we're at.
Mm-hmm. We're planning leaders like Tom and a couple of indivisible leaders, Rose and I, will be talking tomorrow about planning an event for late January, we're thinking, or before the session starts, to bring some people on to become more active in the Duluth area. So look for that.
Wonderful. I think that's all the questions so far.
Okay.
Any others?
Oh, there's Nancy, you asked, what are the legislative obstacles to the deprivatization work or to the healthcare justice work overall? Is it to deprivatization?
Maybe two. I mean, it sounds good. What's the holdback?
Yeah, well, that's a really good point. I mean, some of it is just, ideology that the private sector can do it better. I mean, the private sector sold a bill of goods, quite frankly, not just to our legislature, but legislatures across the country as well as Congress, that if we would just turn this work over to them, they would, A, control costs, B, they would improve quality, and C, they would decrease health disparities. Now, we've been doing this now for about 50 years, and we can't seem to find a single solitary study, peer-reviewed, evidence-based report that would say they're doing any of that. We can find all kinds that says they're doing the exact opposite. But they're a powerful lobby, as you all know. I mean, some days I think we should stop working on everything other than getting the money out of politics, because I don't know how we move anything on behalf of the working class in this country unless we can start to get the money out of politics. But that's probably even harder to do than Medicare for all or for the Minnesota Health Plan, I'm telling you. So the pushback we'll get is just, oh my God, government can't do anything. We can't possibly let government run the program. Of course, the issues with the fraud in the Medicaid program right now are not helpful, although we're hearing more and more that the bulk of that fraud is happening inside of the privatized portions of Medicaid. And so this is, I would make the argument at least that when we hand off our responsibility to have oversight of our dollars and our programs, then this is the kind of thing that ends up happening. And so we need to have more transparency, more accountability, and more close oversight of those programs. So we should take it back for us and control it as part of a state program. So I think, mostly you're just going to get the pushback about, oh, gee, they're doing some of these wonderful things. Usually, again, quantify what those wonderful things are, and who says that we can't get those things done if they truly are real and wonderful, and just do them through direct contracting and make sure that we're actually paying or getting what we're paying for, basically. So it's the usual basic, ideology arguments that private sector can always do everything better. Healthcare has got to be a major exception when it comes to that story. Yes, I agree, Lisa. Government can do this very, very, very well. I'm just looking lots of folks talking about the fact we're entering an election year, so who's supporting and who's not. Couldn't agree more. Peggy Flanagan is endorsed by Bernie Sanders, and she wouldn't be if she didn't support Medicare for All. So wonderful to have Peggy on board. Angie has not taken a position in support, Angie Craig, of Medicare for All. And yeah, we continue to try to work with Kelly Morrison to see if we can't get her on board with Medicare for All, but not to date. We have not been able to do that. In our state, it is Senator Tina Smith, Representatives Ilhan Omar, and Betty McCollum who are signers of the Medicare for All bills on a national level. Many more DFLers in the state House and Senate. I think it's something like 3/4 of the entire DFL caucus has signed on to the Minnesota Health Plan. And the other thing to remember is we're going to get a cost study next year that compares the current system to a single payer Minnesota health plan system. So we're going to finally have some hard numbers that we can use. And then we can start to actually put some funding into the bill to say how we're going to fund the system. And I think that will really help us also move this along when people can do the numbers for themselves and say, how much is my premium now? How much do I pay if I have to pay my maximum out of pocket deductible, right? Add those two together, and then they find out, I don't know what the number is going to be, but let's say it's 5% of your paycheck, similar to what we do for FICA, right? That I'm telling you, most families are 15 to 25% of their entire family household income is being spent on medical care. That would be a pretty significant savings and put a lot of money in people's pockets. It's a bread and butter kitchen table kind of issue, and I think that's how we have to talk about it in 2026.
And I think we have to remind people that health insurance is not health care. It seems simple. It seems like a simple concept, but people are so used to the idea that if I just have insurance, I'll be fine. Well, it turns out most people, you literally cannot afford to buy insurance on your own. This constant idea that we should subsidize premiums, that now it's just a big, huge transfer of wealth from the taxpayers to an industry that is not necessarily resulting in actual health care. So what we want to do is put that money directly into the healthcare system.
That's right.
Down overall costs. So I just think we have to keep reminding ourselves and use that language.
Yes, and agree, Paulo. It really is a nonpartisan issue. We're all human. That's the qualifier when it comes to healthcare. And it may be one thing when you're talking either party when it comes to leadership versus actual voters. And I know Congresswoman Omar did some canvassing a few years ago out in her more purple areas of her district and going door to door. Didn't matter whether they were registered Democrat, Independent, Republican, Green Green Party, whatever. And the canvassers just had a conversation, not about Ilhan, but about healthcare and how it was or wasn't working for them. And it didn't matter what party ideology you were in. They said about 95% of all of the people were like, this system's horrible. It's horrible, horrible, horrible. It's not working for us. And almost everybody had, unfortunately, a healthcare horror story, if not for themselves personally, then for a loved one or, a dear friend or a colleague. So I do think there is a way for this to potentially start to, cross party lines and things like that, because people are really getting fed up with what's happening inside of, insurance-based, employer-based healthcare in this country. And I said in the chat, Amy Klobuchar has not signed on to Medicare for All. I don't personally hold out a lot of hope that she will. That doesn't mean we shouldn't continue to tell her she needs to, because we should. We should continue to lobby her and do everything we can to push on that. But as of right now, I'm not super hopeful that she will sign on. Yeah, right, Paolo. You would know. Coming from Italy, one of those countries that has a form of universal health care. So, all right, it looks like we're good. So, wishing you all a wonderful holiday break. Enjoy one another and try to tune out some of the craziness for a little bit. And let's just all, have a hot toddy and enjoy family and friends. Take care, everyone. See you in 2026, as Ann sent earlier. Bye-bye.